Okay, so this is skill 3 for the EMT on bag valve mask and taking care of an adult apneic patient. So if you were to get this one again, it might be integrated within another scenario where you might be doing an assessment and then need to do these skills for that type of a patient that you find. But we always start on with BSI or body substance isolation on PPE, personal protective equipment, right? That's number one. On your skill check sheets, you're going to put gloves and goggles on out of your jump kit, or verbalize those things as you come in, because that's our standard precautions as an EMT. Right now, obviously, masks are, but hopefully we're wearing one anyways, and just practicing good things. The reason I'm not wearing one right now, I don't have somebody recording. I'm using robots for this. But you're going to come on and you're going to check responsiveness. Again, that's just the 1 point on your sheet. But if you're taking that EMT class, which you should be if you're doing this event or have taken it, you are checking responsiveness, means you're checking AVPU, right? So are they alert to you as you walk up? He is not. Does he respond to my voice? Hey, sir, are you okay? Without touching him, no response. That's verbal. P in AVPU stands for pain, so I'm going to give him a sternal rub. And he's still not responsive. So in AVPU, he is unresponsive as I check for responsiveness. I'm going to go ahead and request ALS backup, some advanced life support, some additional EMS help for this patient. And then I'm going to check for breathing and a pulse simultaneously is what the rubric says. So the National Registry for EMTs says, typically I check a radial pulse on my patient unless they're not obviously breathing. If they're not obviously breathing, I'm going to check a carotid pulse. So in this situation, if he's not obviously breathing and I'm assessing for breathing, I can go ahead and check both simultaneously. So I'm going to check a carotid pulse here on his throat. I might stick my hand here on his chest, and I'm going to check both simultaneously. I'm going to tell the judges for breathing and for a carotid pulse. You need to ask the judges those questions as you're assessing them and tell them what you're doing so they know that you're not just staring at your patient, you're actually asking or looking for breathing. So anything that you do, you're verbalizing so that they can give you the clues that go along with your assessment. So you're checking for breathing, and you're going to verbalize that you would do that for no more than 10 seconds because this patient needs care. So we don't want to waste time. And so you want to make sure you tell the judges that you know that. And they'll let you know that this patient is indeed unresponsive. And they are apneic, meaning that they are not breathing, and they have a very weak pulse of 60. So since they do have a pulse, I do not need CPR on this patient, which is a different skill scenario. But they do need help bringing air into their body. So the next thing I need to do is open their airway. So you have two options to do this. You can do a head tilt chin lift, or you can do a jaw thrust maneuver, remember? And manually open that. You're going to press on their cheekbones with your thumbs and lift up on their jaw to open that airway. Make sure you know the difference on when to do that with spinal cord injuries and what's appropriate. So it says opens the airway properly there. And as you look inside their airway, you might find the judge will tell you that it's full of secretions and vomitus. So one of the supplies that Montana HOSA supplies for you is a suction device. This is not something on your jump kit that you have to bring, but you should know how to work one. So you should work with a station in your area. Ask your volunteer squad, ask your local fire department, ambulance, somebody who teaches EMS in your community, and they can let you borrow one. There are some that are manual that you would squeeze, and that would be fine if you wanted to use that. But I would bring that one with you then, because you should know how to use something like this. This is the type that you'll be using on scene. So make sure you know how to use one of these. You're going to put on the rigid tip onto it, which is this Yankauer tip. That's hard plastic. So you're going to go ahead and verbalize that. And we're going to go ahead and turn it on. So National Registry, remember, if you're doing this skill, there's lots of steps you need to verbalize on how to use this properly. I would make sure the judges know that you know how to do that, even though you don't have to verbalize that. So again, you turn it on. It's really loud, so I'm going to turn it off so you can hear me. But with it still being on, I would test for suction. There's a hole in this. I don't know if you can see that close, but I need to put my finger over that hole and it would suction. When my finger's not on that hole, it won't suction. So proper protocol would to make sure that I know that it's working before I stick it in their mouth. I like to kind of measure a little bit on how far I can go in, especially if their mouth is really full of secretions. And typically when we insert things such as an OPA, we go from the tip of the mouth to the tip of the ear. So I don't want to go any further than that. So I verbally kind of mark that on my Yankauer tip. And I look inside their mouth, and I never go in further than I can see my tip. I want to have control over that the whole time. So these are things I'd be telling the judge. On the rubric, it does say that you do need to make sure you tell the judge that you would go in without any suction on, so your finger is off that hole. Now it's in that hole. I would move that around for no more than 15 seconds and pull that out with my finger on it, and then go ahead and turn that off, and the judge would let you know that their airway is now clear. So again, I would do a manual maneuver on their airway to open it and look inside. And this time, because my patient's unresponsive, I'm going to give them an OPA. You bring these in your kit. You should have different sizes. So you want to make sure you pick an appropriate size by measuring and show the judge that you know how to do that. From the corner of the mouth to the tip of the ear. I like to put this in. It goes upside down, and I twist it 180. And it goes in just like that on that patient. So make sure you've practiced with these. Different airway mannequins can take these. A lot of the CPR mannequins cannot. So at state, you'll have a mannequin that can accept an airway and accept suctioning. They'll tell you that there's no gag reflex, and he accepts that oral airway just fine. Now I'm going to go ahead and get ready to bag him with a bag valve mask. That's that BVM. Again, a supply that you're responsible for bringing and making sure that you know how to use. So for bagging, I'm just going to make sure again that he still has a pulse and doesn't need CPR during that time. So I'm going to check for a pulse for no more than 10 seconds. He does still have a pulse. And we're going to bag him without oxygen first. Sorry, you were going to check the pulse after that time. So I'm going to go ahead and bag him without connecting myself to oxygen first. And the reason being is the room air does still have oxygen in it. And he's been without air for a long time. And so I want to make sure that I start to get him ventilated. So we'll ventilate him for usually for 30 seconds here, and that it's working. So make sure you know how to use one of these. It's a CE clamp that we use. So a C here and an E here. The C goes on top of the hard plastic, like this, and then the E is going to grip underneath their jaw to give you a head tilt, chin lift, and open up that airway so that you get air into the lungs instead of into the stomach and have gastric distension with that. I like to pull my mask back first to help me get a good seal and put that on there, and then I use my CE clamp. You stand at the head of the patient, and you're going to bag. You're going to look for adequate chest rise as you do that on the mannequin that you have. The judge will tell you that you'll be able to bag without any difficulty. Now is where you would check that pulse again on this rubric. At this point, after I've bagged him for about 30 seconds, I would go ahead and connect this to oxygen. In this scenario, Montana HOSA would provide oxygen, and the regulator would already be set up for you. This is just a stubby tank. We'd probably have some taller ones. So you would connect this here to the Christmas tree piece of this and turn your dial on the end of your regulator to 15 liters per minute. With that staying on there, your tank always stays flat. And I would go back to bagging that patient. So I'm going to go back to that same way of getting a good seal. I'm going to verbalize to the judge that I would do this at a normal adult breathing rate, somewhere between 10 and 12 breaths per minute. That works out to about 5 to 6 seconds between every squeeze. So I'm going to squeeze slowly over the course of a second, watching for chest rise. And I'm going to count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. And ventilate again. And they're going to ask that you continue to do that. And then as the scenario is going on, you might be again working with your partner because it's a two-person event. So having good communication skills of what's going on. Maybe your partner's continuing to do an assessment on this patient. Maybe there's more than one patient. So appropriate communication between you, your partner, other personnel, and your patient if they were to become awake or another patient on scene of what's going on are how you're awarded points in here. So this is a skill where you're taking a lot of EMT skills that you're learning in class, adjuncts, suctioning, bagging, using oxygen, and putting those all together to take care of this patient in skill number 3. Reach out if you guys have any questions.